The Israeli government today announced a revised number of people killed on October 7th when Hamas gunmen stormed a number of Israeli towns. The estimated death toll is now 1,200, down from 1,400. Hamas officials, meanwhile, say at least 22 people are dead after 3 hospitals in a school were hit by Israeli airstrikes. Gaza's biggest hospital, Al-Shifa, was reportedly one of those struck. Dr. Ghazan Abu Sita is a British-Palestinian doctor who has been working there since the beginning of the war. He sent us updates today from the Al-Ali hospital where he's working.
The health system is collapsed. There's no more health system in the northern part of Gaza. The whole of the northern part of Gaza only has the Indonesian hospital and the remnants of Al-Ahli Baptist Hospital functioning. Shifa Hospital has effectively fallen. We are just running a kind of trauma stabilization field hospital at Ahli, just from all the wounded that came directly to us or from Shifa. And Indonesian has run out of fuel. Shifa has fallen. The staff have left. Majority of the staff has left. Anyone who's wounded and is able to walk has left. Only those who are too injured to move are inside with a core group of staff. So basically, you've destroyed all of the pediatric hospitals, all 3 children's hospitals, put them out of service. You've attacked the cancer hospital, put it out of service. You've attacked Al-Quds hospital, put it out of service. Al-Awda's run out of fuel. Kamal Udwan has run out of fuel. And now you've attacked Shifa. It's been targeted all day with Israeli missiles, and so people have just run away.
For more on this, Joseph Belliveau is the Executive Director of Doctors Without Borders Canada, and he joins us now. So we just heard from a doctor in Gaza who says the health system in northern Gaza has effectively collapsed following several strikes on hospitals. You've got over 300 colleagues in Gaza right now. What are you hearing from them?
Just this morning, in fact, we got a few messages from our doctor and medic colleagues in northern Gaza, and I'd like to read a couple of those messages here now because I think it really paints the picture. I was heading to Al-Shifa hospital to work this morning when the facility was hit. All of us were horrified. Some of us threw ourselves to the ground. I saw dead bodies, including women and children. And another doctor colleague had this to say: we might not survive until morning. We don't want to be killed here just only because we remain committed to our patients and to our medical profession. So I think that just gives a sense of how dire and desperate the situation is. I think to say that the health system is failing right in front of us is an accurate portrayal of what's happening.
Yeah, we're hearing some reports that hospitals are being evacuated. Is it possible, though, to evacuate some of these hospitals completely? I mean, we're talking about babies in incubators, children in intensive care. Where do they even go?
Well, these orders to evacuate hospitals are nothing new. They've been happening for the last several weeks. And my colleagues, the doctors and medics in these hospitals, have said repeatedly, it is simply not possible to move this number of people, injured people in particular, and also critically ill patients too, newborn babies on incubators, pregnant women in their final trimesters. There's so many patients that simply can't move, and we are continuously seeing this constant wave of injured people because the bombing hasn't let up at all. So injured civilians are coming into the hospital routinely, and where shall they go? First of all, they can't move from these facilities because some of them are so injured. But secondly, where shall they go? There's no safe place in Gaza. It's maybe slightly safer in the south, but the bombing continues there. How shall you get there safely? And then, layered on top of all this, and this is where MSF, or Doctors Without Borders, is coming from in calling for a ceasefire, something we very rarely do, is that the medical facilities themselves are supposed to be protected spaces under international humanitarian law. Civilians must be distinguished from combatants in wartime, and measures taken to protect civilians, and specifically and explicitly including medical spaces. And that's just, there's no humane reason or excuse for this continued bombing, and especially directly on medical facilities.
Israel does say, though, that Hamas is operating out of the Al-Shifa hospital, which means that under international law, it loses its protected status. It becomes a legitimate target. What do you make of that argument from the Israeli state?
So here's what we can say definitively, is that there are thousands, literally thousands of civilians in this facility. And we know this because more than half of them, the majority of them, are women and children. And we know this because people have come as civilians, unarmed, ununiformed, simply to seek safety in these facilities. The way that my colleagues are describing Al-Shifa, but the other fairly functional health facilities now is just one of just absolute chaos of humanity, where you've got patients lined up in the hallways. Of course, we've spoken before about how we've run out of fuel for generators, and the electricity is intermittent at best now. We've run out of gauze, we've run out of painkillers. We're literally doing surgical interventions on the floors, in the hallways, wherever it's possible. One doctor was just describing how they're having to use vinegar to disinfect wounds, and to describe that this is a place where Hamas has a base or something, that just does not square with the desperate needs of the people that my colleagues are describing in these hospital facilities. So to move from making that declaration to we're going to go ahead and bomb this hospital is unconscionable. And this is why we're coming out now. As I said, it's a very unusual thing for MSF to do, but to call for a complete ceasefire. Normally, we would ask parties to conflict to respect international humanitarian law, to distinguish combatants from non-combatants, protect humanitarian spaces, don't do siege warfare, also very much against humanitarian law. But we wouldn't call for the parties to stop their warring. In this case, we think it's the only possible opportunity. We just stop the bombing.
As you know, the Canadian government, though, is not yet calling for a ceasefire. They are still pushing the idea of routine humanitarian pauses to get people out and to get aid in. What do you make of the government's stance on this issue, given what you've just told us?
Well, any moment when there's not a bomb falling from the sky is a good thing. That's a good moment. But a pause indicates the resumption of the warring tactics that are currently being used. And so we can't abide by let's have short pauses and then resume this type of warfare, because it is so egregiously against humanitarian law, because it's so egregiously impacting civilians. And we see this sort of language where let's have these pauses so that we can increase some form of a humanitarian response. And obviously, as a humanitarian, MSF is a humanitarian organization. So we have been also, getting trucks together and getting teams together for that possibility to get in and provide and scale up humanitarian assistance. But to speak in terms of these pauses to increase humanitarian aid feels like using humanitarian assistance as an excuse for political impact, because what's needed right now is really strong political action to put an end to the bombing and to the bombing and the siege warfare.
Okay, let's leave it there. Thank you. Joseph Belliveau, Executive Director of Doctors Without Borders. Appreciate your time, sir.
Thanks so much, Dave.